use this also. Graph.
Here's the contact info variant for IS.
Yes. Now, this talk will be of general interest. I think I'll stand on the computer much easier. This talk is on molecular therapeutics. Transforming musculoskeletal care, but I'll show you something more also. I'm Dr. L. Prakash. Simple example. Chronic renal failure on daily peritoneal dialysis, non-healing ulcer of 18 months, calcaneum exposed. You can see the depth of the wound. The message is here, and middle lines are famous. One doctor advises below knee amputation. Second opinion, Ganga have advised antibiotic bone spacer, sir. So 1.5 years, chronic renal failure, uncontrolled diabetic, calcaneum visible. So that is the patient. And that's him within 7 days, 14 days, 21 days, month. Fully healed from one end to the other. Another example. Bad foot wound, hungating, diabetic. After a single session of 48 hours after ozone bagging injection, ozonated glycerine application, healing in just 12 days. What he suffered for 4 months. You can see another bad wound immediately after peripheral injection of ozone. 6 months non-healing ulcer, healed in 14 days. This is a case of chickenpox, monkeypox. Doctor's sister had one hydrogen infusion in the night, and you can see within 12 hours, the viral infection is practically gone. The monkeypox is gone. And this human papillomavirus, young lady was really in panic. After one single session of EBOO, her warts fell off and she became HPV negative. Buccal cancer with leukoplakia. You can see that. Just ozonated glycerine application, and within 3 weeks, his buccal cancer disappears. And now, see this ulcer. This is a 2-year non-healing ulcer, severely diabetic, HbA1c of 13.2, advised mid-foot amputation, and there it's totally healed. You can see he's had a ray amputation because of diabetes, that healed in 6 weeks. Another one, again he had a ray amputation, chronic diabetic, field worker. In 3 months, you can see he's back to the fields and the foot is normal. A very rare case, this is from Nepal, our Dipendra's case. And you can see how beautifully this will heal up by just scraping. Yaws, this is a case of yaws. Even in UK, they say it's untreatable. He was treated with ivermectin, albendazole, scraping, and ozone bagging, and ozonated glycerine application. And of course, the hot topic of today, avascular necrosis of femoral head. Our standard protocol is 1 MHT or EBOO with Mukherjee regime, and 180 hips have been saved from THR in my series. Publication is being made. You can see the hip. This sector avascular necrosis, more than 1/3 of the head is dead, impending collapse. You can see it's very clear. And there you can see after 18 months, the head has revascularized. It is normal in shape, and both hips are identical. Another one, you can see this one is Figat grade 4 with impending collapse. You can see how both heads are near collapse stage. How after Ozone and Mukherjee regime, they are improving. I'm sorry that Dr. Mukherjee is not here because of his brother's illness, brother's demise. Else he would have spoken about his regime. And there the end is at 18 months. So everybody said that this hip needs a total hip replacement. And there he is without a total hip replacement. So 2 MASTs, 1 EBOO, Mukherjee regime, 12 months. This is the case. This is an interesting case of a doctor, professor of medicine, hepatobiliary carcinoma, huge ascites, had 2 sessions of chemo, hardly weighed 28 kilograms. On the left, while his ascites is being aspirated, on the right, after therapy, you can see there his ascites is being aspirated, and we could take out about 3 liters of fluid, and after which he received his renal filter free EBOO. We don't use filters for EBOO. We actually bubble large quantities of ozone, like 400,000 to 600,000 microgram into blood directly, which takes care of cancers and things like that. Let's see if we get his audio. Now you can tell.
I myself, Professor Dr. Pujin Prabhu, MD Medicine, have taken books from Dr. L. Prakash. Dr. L. Prakash, after chemo of pancreatic ductal adenocarcinoma.
Pancreatic ductal adenocarcinoma.
The side effect dramatically reduced and all hair grow well, scalp and all side effects like white hairs, ranks, reduce and ascites were developed at that time. Now ascites gone away after triple CT scan. There are no ascites at all. Excellent.
So molecular therapeutics produces real wonderful quantifiable results in a wide variety of cases. So this is one of our friends who was an orthopedic surgeon who had the first experiment of the highest dose of EBOO of 750,000 micrograms in one session, the highest in the world. And he is a person who had taken radiotherapy and chemotherapy for an astrocytoma of the brain, orthopedic surgeon, bedridden. Immediately after surgery, he recovered and he goes to gym and is back to operating. OPD surgery, morning walk, evening walk, and he's now starting his own. And we have instant reliefs in psoriatic patients with very stubbornly looking and things like that. So this is the miracle of the modern molecular medicine, the magic. What is molecular medicine? The use of natural molecules which are either available or alien on Earth. The two common molecules used in medicine, ozone and hydrogen. Many people in Malaysia have told me incorrectly that ozone is banned in Malaysia. It is not. I'll get you details subsequently. It is not banned in Malaysia. What are these molecules that produce such seeming miracles? What is EBOO, MAST, and hydrogen infusion? This morning, Prasham Shah has given some talk on this, where he would have covered part of it. This is me myself taking an MAST, back it in a bottle, heparin is put in, the set is primed with heparin, for speed of video. I take it once a month for my general wellness. It is put in a hanger, a small butterfly is used, vein is punctured, and the bucket allows the blood to flow in, ozone is collected, put in the bottle is inverted, and the blood is allowed to flow back in our body. This one shot will give me about 12,000 micrograms of ozone. Now we give close to 50, 60,000 micrograms. This whole procedure takes only 6 minutes to do. Ozone is a naturally friendly, naturally occurring molecule. Thunders and clouds, waterfalls, all of these produce ozone. Thanks to Prasham. We live on a polluted earth today. The ozone layer in the stratosphere detoxifies and keeps us safe. And this is produced in our clinic with an ozone generator, which is nothing. We just pass sparks of electricity through a borosilicate tube with oxygen, and that's converted to ozone. We need a dry regulator and a cylinder, and can be administered by many routes and causes many beneficial effects. Given intraarticular, it causes gaseous arthrodiastasis in step joints. You can see an wrist before and after, an elbow before and after, and wrist, and that's a hip. Interesting. That's, you can see there's hardly any joint space there. The instant you inject ozone, the joint will open up. Another one, hip, bad. Just inject ozone and watch how the joint opens up. Boop, there it opens up. So joint space just comes out. Another one, you can see hardly any joint space. And there you go, joint opens up. So this patient gets remarkable improvement from pain. Good movements, THR is delayed. Hydrogen is a wonder molecule that can be combined with ozone to produce something called hydrozone. Though hydrogen is the most abundant molecule in the universe, it is not found in its native form on this earth because it's diatomic, just two atoms. It's a new modern miracle in the modern medicine, which is the strongest antioxidant known so far. Numerous clinical studies have found that molecular hydrogen is very beneficial in a wide variety of conditions, from severe hypertension to post malignancies to chemotoxicity. Here's a friend, his BP on monitor was 141 by 92 before hydrogen inhalation, the doctor friend. And there he is, he was having his hydrogen infusion. And as you can see in the BP monitor, where his BP is there, it is 145 by 96 or something there in the back. He is Dr. Pankaj Katole, an orthopedic surgeon. And when he bought the hydrogen machine, the first person on whom he had an infusion was himself. And the next day, his blood pressure was 115 by 75. No antihypertensives taken. To produce 99% purity hydrogen, a hydrogen generator is needed. That's a hydrogen generator. And this is how to know that we have a generator which produces hydrogen. You flame it and it will burn because pure hydrogen is flammable. And you can't blow this flame out by blowing it out. You dip it in water to extinguish it. So whenever buy a hydrogen machine, to ensure that it really produces hydrogen, you have to connect a tube and flame it. This is how drips abroad cost. And a bumper drip is like 850 pounds. All the nutraceuticals with hydrogen. IV bubble hydrogen, supersaturate hydrogen and push it into saline and give it IV. So this is an example of me taking hydrogen enriched saline. Hydrogen is being bubbled in the bottle. Excess hydrogen is allowed to slip out. It needs 9 minutes per 100 ml to saturate a 100 ml bottle of saline. If it's a 200 ml bottle, we saturate it for 18 minutes of bubbling with 600 ml per minute of hydrogen. And you can see the micro bubbles in the globule, which is going into the body, which will directly act on the mitochondria. So after a single infusion, the energy levels 1 week before was 450 calories a day. 1 week later, it becomes 700 calories. These days, my average caloric output is 1025 calories a day. So now this is a very important question. How do these molecules act and how do they produce, or why do they produce such wonderful results? The current theory, its only theory, is mitochondrial shock, which regulates the rogue mitochondria. To understand this, we need to delve a little deeper into mitochondria. Mitochondria is known as the powerhouse of every individual cell. However, we now know that mitochondrial genes are entirely different from human cellular genes. So you have two sets of genes in your body, your own genes and your mitochondrial genes. Each of these person in this picture will have very different cellular DNA, but strikingly similar mitochondrial DNA. Close to 99%, 99.5% DNA of mitochondria will be the same. It is currently postulated that all humans inherit their mitochondria from a single female X chromosome. That is called the mother mitochondria or the mitochondrial Eve, probably of African descent. As per the current theory, mitochondria were once bacteria. Their genes closely resemble a few genus of bacteria. Unlike taught us in physiology class, there is not single mitochondria in a cell. Depending on the area and location, the number of mitochondria in each cell can go from 1 to 32. Way past, when cells engulfed mitochondria, when the cells were strong, mitochondria were digested. When the mitochondria was stronger, it killed the cell. In some rare cases, cell and mitochondria developed a symbiotic relationship. Mitochondria supplied energy, cell supplied nutrition. And that is how we could grow to multicellular organisms of such great complexity that we stand here evolved speaking on mitochondria itself. Over a period of time, mitochondria assumed greater responsibilities: cell multiplication, apoptosis, cell death, immune system aging, telomere length, and so on. So, these mitochondria were not happy enough with the responsibilities assigned. So apart from producing energy, it started controlling the entire cellular architecture. Now, what happens if mitochondria becomes rogue? Uncontrolled cell multiplication will cause cancer. Decreased cell health will cause aging. Disturbed immune status will cause autoimmune disorders, rheumatoid arthritis, psoriasis, lupus erythematosus, etc. And shortened telomere length will cause physiological aging. In such cases, we must reset the mitochondria. Morning, we had a wonderful talk by Adelina about how she conquered cancer. And there she spoke a little vaguely how she reset her mitochondria by a plethora of methods, but she was not precisely sure what actually reset her mitochondria. Mitochondrial reset switches in order of efficiency high to low. This is as per the recent literature, Japanese literature. These things can reset your mitochondria and can work in autoimmune diseases to cancer. EBOO produces the fastest and most acceptable reset. And this is not that as a filter EBOO, this is an actual EBOO where ozone is bubbled into the blood. Next is major autoimmunotherapy, where again high concentration of ozone is bubbled into blood. Third is hypothermia at minus 170 degrees for 180 seconds. The person is put into a cryo chamber for 180 seconds at minus 170 degrees. He is given mittens and gloves and toe covers to prevent frostbite. And this once 170 degrees, and then he comes out and goes into a hot sauna. Then comes hydrogen bubble infusions, and then comes hyperthermia by hot saunas. So all of these 5 reset the rogue mitochondrial switch. So item 1, 2, and 4 are extremely cheap and can be administered in the clinic. Item 3 needs a setup in few crores where we need a cryo chamber. And item 4, setting up a sauna, you all know how expensive it is. So acting at mitochondrial level, the effect of molecular therapies has to be found to be age regressive, performance enhancer, useful in COPDs, cancers, allergies, and numerous other conditions like diabetes, hypertension, etc. So this is my own story. My IOS conference, gone to Nepal, and I had high altitude hypertension. When I came back, my blood pressure was 163 by 98. I was scared. I even asked Divakar, should I start antihypertensives? He said, why should you start antihypertensives? One reading is not hypertension. What I did, I just took an hydrogen infusion, and immediately after that, my BP came down to 144 by 90. Single hydrogen IV. So 163 98 comes back 144 by 90. Diastolic 8 mm 90 came down. Subsequent pictures are my daily BP recordings, no medications taken. The watch beside the machine shows the dates and times. Next day, 149.89, 125.85, 103 by 69. So from 163 by 98, it has come down to 103 by 69. No medications. Even now, I don't take any medications. And 60 mm systolic and 30 mm diastolic pressure reduced in 48 hours and no medications ever. The infusion I take is 2 grams of vitamin C, 1.2 grams glutathione, 1 ampule B12, 1 ampule polybion, 600 ml of 99.9% pure hydrogen bubbled infusion. This my VP just last Monday, before coming here for the conference, which I recorded, 120 by 77 with 67 pulse. I'm trying weekly infusions in about 26 hypertensive patients and writing a paper on that. Later, I experimented on intra-articular injection in osteoarthritis combining ozone and hydrogen, which we call hydrozone. And this is an example of hydrozone in a hip, arthritic hip. And you can see there it opens. And it opens a little better than ozone alone. And you can see it's a circumferential opening. This is a mother of a senior technocrat. You can see the age, the date, standing x-rays. And this is a grade 4 OA with gross middle compartment arthritis. And the patient refused any form of surgery. I just gave her a hydrozone and Mukherjee regime, something like what Dr. Naresh spoke in the afternoon about DMARDs. And that is her exactly after 6 months. You can see the medial joint lines appearing. I'm putting the comparative x-rays. You can see the names and dates again. Same Sita Devi. And what is the date on the left? It is 2/4/2024. And the date on the right is 4/11/2024. So between 4 and 11, 8 months. And you can see how dramatically the joint is opened up. No PRP, no biologicals, no regenerative medicine, no surgery, just molecular therapeutics. This is how we do our EBOO. This is a patient with polyarticular rheumatoid arthritis. So blood goes into a glass container, ozonized, and you can see the striking color difference between the venous blood going in and the bright red blood coming out. There's a short 1-minute video with audio made by my staff using AI and an alien language. Donor vein is connected to a perfusion pump.
This is the short video of the procedure. A perfusion pump is used to draw blood from one vein and introduce it into IAOS, glass EBOO flask, where it is ozonated in a membrane-free environment.
So we use 100 micrograms per ml bubbled directly into the blood.
Pump into the special glass EBOO.
And as the ozone is bubbled, you can see the blood becoming tomato red or cherry red. Dr. Rose here is smiling because she just saw a demonstration and she couldn't believe her eyes.
EBOO is not dialysis or blood filtration.
So no filters are used, no dialysis machines are used, no huge pumps are there. And you can see how the blood color changes. In 8 minutes, 100,000 micrograms are infused. No destroyers are used. We don't throw away liters of fluid saying that it is waste. We don't throw away liters of protein. It's useful in numerous conditions. And I personally have a large series of
Cancer rehab and even performance enhancement.
So I have right now about 11 patients whose HIV has been made column negative with our EBOO. The important question for Malaysia, is ozone therapy banned in Malaysia? I can categorically say there is no direct ban on ozone therapy in Malaysia. I had even talked to somebody in the medical council. He sent me a PDF file. This is from the Malaysian Medical Council PDF of regulations. This clearly says that there have been various clarifications sought from several sources on the efficiency and benefits of the usage of ozone and chelation therapy as a therapeutic regimen for option by registered medical practitioner. The council, after exhaustive discussions and relying on information, instead of relying, they typed relaying, obtained from local and overseas scientific databases, concluded there is no evidence to support any therapeutic benefit from the usage of above mentioned therapy for any illness. It's obvious that they have not seen my evidences presented today. So it's ignorance that is speaking. Consequently, there is need for further research especially on indications for the usage, their safety and efficiency. As such, registered medical practitioners are advised not to use and or apply these two modalities except for research purposes until conclusive evidence of definitive benefit can be ascertained or proved. Meaning that unless we research and document and produce results, they are not going to either approve it or disprove it. So today, if you want to do any ozone procedure on any patient, it becomes a part of a research protocol. And in your consent, you say that the patient is accepting to be a part or subject of a research protocol of which documentation is being made and relevant proof will be produced as per this circular dated 7th October 2011. So I can send a PDF of this document. So conclusion is ozone is not banned. They only cautioned against using it. I'm coming to the close of my talk. There's only a cautionary note. There's no ban per se. Take proper consent. Don't promise the sky. Take the patient into confidence. Explain the procedure. Include the word experimental therapy in the consent, and you are done. How are we solving this problem in India? That's an MS orthopedics question paper, and ozone therapy in orthopedics is a short note worth 10 marks. In John Ebenezer's textbook of orthopedics for undergraduates, ozone has been included as a topic. I've written a chapter on ozone in a pharmacology book for undergraduates. So in India, at least another year or two, ozone is going to come into mainstream. Hopefully the same thing happens in Malaysia. And blocks ozone MAHT EBOO with early function, speeds up bone healing dramatically. One small case, trochanteric fracture, Italian lady. I think I'd shown the case yesterday. Amritsar, there she is. After immediately one block, she's walking. And this small slide, I'll say, she's thanking me. And there she is walking one, walking two. There's 4 weeks. You can see that she's just carrying the walkers. And you can see the x-rays very clearly. 4th February on one side, 24th March on the other side. Just 49 days and the fracture is healed. A trochanteric fracture heals without surgery in 49 days. That's her, and that's her, and that's her at exactly 65 days. So an intertrochanteric fracture without a DHS or a PFN, with just these modern molecular methods, without surgery, is practically back to normal in less than 65 days or 2 months. Be aware of rogue mitochondria and the detrimental effects on human body, cellular, and immunological level. Learn to reset mitochondria by less expensive methods than whole body cryogenic therapy. Ozone is less understood and hydrogen is yet to be fully discovered medical molecule. Master ozone and hydrogen and we can conquer many unconquerables. Numerous conditions can be treated with these methods. We need much more research and studies on this. Hundreds of therapists are using hydrogen and ozone IV therapies and results so far are pretty outstanding. All therapists are welcome to join us in the studies. Let us document, let us experiment, let us keep records, and let us change history and leave footprints over sands of time. Feel free to message me on this number. You can photograph this side. I'll send you all details I have, references to various publications. This is the number where you have to send me a message. I've got about 1,000 pages of literature on ozone and 900 pages of literature on hydrogen. I'll be happy to share you the PDF. Thank you all very much. I did exceed about 6 minutes of my time, for which I apologize. Thanks for your patient listening. And I'm extremely happy to see a full hall with rapt attention. Thank you very much. Thanks.
Thank you, Dr. Prakash.